What are the alternatives to opioids in treating chronic pain? There are many things, fortunately, that can be done here. So we'll start with medications, but that are not opioids. So good old-fashioned Tylenol has been proven to be just as helpful as Advil or Ibuprofen, otherwise known as Motrin. So Tylenol and Ibuprofen can help treat pain, chronic pain, just as well as opioids can. In fact, it has a better side effect profile and it can in fact deal with pain better. This has been proven just recently in a study of people with chronic hip and knee pain. Taking these adjunctive therapies like that certainly can help with those other non-opioid medications. There's other types of antispasm medications, there's certain antidepressants, there's a whole host of new medications out there that can help with neuropathic pain. So there are alternatives that aren't addictive that can be prescribed by your healthcare provider. Lastly, there's many other ways of treating pain. Pain is not just something that comes from the location of origin, it's how we process pain in our minds that's important. So the way in which a person approaches pain from a psychological standpoint, cognitive behavioral therapy is what I'm talking about here, where a person has learned techniques of dealing with their pain by removing themselves from their body and looking outwards in, and objectively seeing themselves for who they are and what's going on. Practicing mindfulness is related to this very closely. Practicing meditation, journaling, all these sort of things can help people keeping track of their pain and to cope with it from a non-pharmaceutical standpoint. Finally, there's other alternatives as well for chronic pain, which are becoming more and more common, and this is what's known as an interventional pain clinic or pain clinic. But this is where specialized physicians, typically anesthesiologists, but sometimes other trained physicians who know how to use these techniques, where they inject needles containing anesthetics like local freezing, like lidocaine, or anti-inflammatory steroids like cortisone, are injected into the painful spot and can provide nerve blocks as well. So there's a whole host of ways of treating pain from a non-pharmacologic standpoint, or non-opioid standpoint I should say. There's plenty of ways of dealing with pain from a psychological standpoint, and lastly from interventional pain clinics, which do not involve opioids but rather anti-inflammatories and freezing medications that can be employed once in a while to help deal with the pain. So I hope this helps. If you have any questions, please leave it in the comments box below. Thank you.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.